I want to do work that I can explain to my mother, that I can explain to my sisters, that I can explain to my daughter in a way that is going to be digestible to them. And if I can't do that, then I think that I have failed in my work as a scientist, in my work as a bioethicist. Hi, I'm Daphne Martschenko, and I'm an assistant professor at the Stanford Center for Biomedical Ethics. The work that I'm doing that is funded by IAJS is specifically around recognizing the fact that a lot of the frameworks for thinking about race, ethnicity, and ancestry in the context of genomics have come out of the West. Then they're broadly applied outside of those contexts. One thing that you have to know about my work is that I try and expand who is included in decision-making conversations around how science should get done. I realized that in genomics, so much of what work gets done in that arena is driven and dictated by European and American institutions and the researchers within them. And so wanting to bring in folks who are not in those contexts, who are doing research outside those contexts and are residing outside those contexts into the discussion is an attempt to try and develop more context-specific, context-relevant approaches to genomic research, and with specific focus on these descriptors, things like race, ethnicity, and ancestry. The work that I'm doing with IAJS is around bringing in African scientists, members of the African scientific community, to those conversations about race, ethnicity, and ancestry, and really challenging the implementation of these Western developed frameworks in contexts that have a very different history and a different set of lived experiences. We have a very extensive history of using genetics or genetic ideologies, genetic claims, to make arguments about differences between people that have really resulted in social harms. And this way of thinking about genetics has had implications for how we design and implement our policies, the kinds of laws that we institute within a society like the United States. At the same time, though, there's immense promise that comes out of doing genomic science. The completion of the Human Genome Project in 2003, for instance, kind of ushered in this precision medicine movement that we find ourselves in right now. I think the key is really being able to balance those things, maximizing all the promises that can come out of genomic science alongside efforts to minimize risks. And ways to do that include, being very transparent and intentional about the terminology that you're using, the methods that you're using, having very clear justifications for those things, and also recognizing how much time and context play a role in the questions that get asked and the approaches to answering those questions. The last several years, probably the last decade, there's been a big conversation in genetics about how the vast majority of data that is available for research in the field has been collected from a very narrow subset of the global population. Most of the data that's being used in genetics for things like precision medicine research has been collected on people of European descent. Recognizing these Eurocentric biases in the data set, the genetics community has put in a lot of effort to try and diversify the data that is available. So we've seen examples of capacity building efforts to try and increase the research infrastructure in continents like Africa, in South America, so that we have more representative data to use for research, with the hope that that will result in benefits to a wider swath of people. At the same time, however, the field hasn't done a very good job of taking and including the perspectives of those who they're trying to get data from into foundational decision-making conversations about what kinds of frameworks to adopt in the field, how best to collect the data, thinking about the risk and the benefits of it. And so some of the work that I'm doing that IAJS is funding is really about bringing those perspectives into these decision-making conversations. So not just seeing African scientists as folks who are going to collect data that is then going to benefit institutions in the West, but including these researchers and their perspectives in these really foundational conversations about what kind of terminology should we be using? How should we be collecting this data? What do the terms that are coming out of the Western context mean when you apply them in a different context? I think it's really important to think through how to engage the public, engage communities who exist outside of the scientific establishment, whether that's through doing things like writing op-eds or going on podcasts or writing more publicly accessible books. I think it's important to understand what are the desires, the values, the perspectives of those who traditionally have not been included in decision-making conversations about when to do science, how to do science, what kind of science to do. Being able to get funding to start down a new path of research has been transformational in that I was able to apply for a very large international foundation fund because of the work that I got started through IAJS. IAJS allowed me to do work that I wouldn't have been able to do otherwise, and it also opened up a door for a new line of research exploration.